Welcome everyone again to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box. Make sure you can ask those anytime you feel comfortable, but do know that we hold them until the end, and oftentimes it's not possible for us to get to all of the questions. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. And if you are pursuing APA continuing education credits, the link for the survey that you'll complete to get your certificates will also be in the chat box, but that link will be posted near the end of the presentation. So keep your eye near the top of the hour as the webinar is closing for that link. Bookmark or copy that link or open it before the webinar closes, and make sure that you save your certificate after you complete the survey because we don't have access to those after the fact. If you missed last week's talk in the series, Dr. Emmy Wood's great discussion of unique considerations for competency evaluations for those with intellectual disabilities is now available on our YouTube channel. The recording for this week's talk should also be available on our YouTube channel sometime later this week, and PowerPoint slides for those that have registered for this series will be available later this week as well. As a heads up, next week we have Dr. Candace Shields who will be discussing voluntary and involuntary intoxication, fixed and settled conditions, and legal insanity. But coming back to this week, I'm excited to introduce you to today's speaker who'll be discussing active bystandership in law enforcement and correction settings. This is Dr. Abigail Tucker. Dr. Abigail Tucker is a licensed psychologist in Denver, Colorado, board certified in police and public safety with the American Board of Professional Psychology. She works directly with correctional staff, emergency responders, veterans, victims of crime, and behavioral health providers. Dr. Tucker is an adjunct faculty member at Colorado State University Global and Nova Southeastern University, focusing on emergency responder and military psychology. Dr. Tucker is a national training instructor for the Active Bystandership for Law Enforcement Project and co-founder of Heroes Active Bystandership Training. She holds a BA in psychology from Loyola College, Maryland, and an MS in Psy.D in clinical psychology from Nova Southeastern University. Her diverse experiences include postdoctoral training in forensics at Eastern Shore Psychological Services and roles in Chief Clinical Officer at Community Reach Center in Westminster, Colorado, Chief Strategy Officer at Polara Health in Prescott, Arizona, and as a psychologist at KidsPeace in Orefield, Pennsylvania. So Dr. Tucker, Abigail, on behalf of the University of New Mexico, thank you so much again for joining our series, and I know we're very excited for you sharing your particular expertise with us today. I will go ahead and toss it over to you.
Thank you so much. Appreciate it. I'm definitely excited to be here. Can I just get a quick thumbs up that you can see my slides? Perfect. Thank you so much. Just want to make sure before I keep rolling. Want to cover some important logistics and information before we really get rolling here on the presentation. I know that this was just covered, but as a reminder, there are links in the chat, and here's some additional information on receiving continuing education credits. But I would encourage you to pay attention to the links in the chat that are there now and the ones that will be posted towards the end of this session. I do want to take time and pause very mindfully on the disclosures. It's really important. I'm going to read verbatim, although that's not my norm for PowerPoint slides, but it's important that we are clear about any potential conflicts of interest. So I am the co-founder of Heroes Active Bystandership Training, and I also work for ABLE Active Bystandership Training for law enforcement, and both provide active bystandership training to correctional and other agencies. While Heroes is a commercial entity related to the content of this activity, I am not receiving any funds, contracts, or financial compensation related to this presentation. My focus in this session is on sharing the social science behind active bystandership in forensic settings. There are some additional disclosures there about certainly about the University of New Mexico's policy, that the following planners and faculty disclose they also have no relevant financial relationships or commercial interest, and that the following CME reviewers who also reviewed this in advance have no relevant financial interest with this content. As a reminder, these views expressed in this presentation are mine and mine only. I'm not reflecting the views and policies and positions of the University of New Mexico. The learning objectives. I'm very, you heard this at the beginning, but as a reminder, these slides are being provided to you in the link when you register through Qualtrics, and I will reference your downloading them and using them a couple of times throughout this presentation. Our learning objectives today, we're going to be reviewing some policies from the Department of Justice, specifically on the affirmative duty to intervene, as well as the ethical implications for psychologists and others working in forensic settings. We're going to talk about those in comparison to some research and inhibitors, and specifically how it applies to law enforcement and correctional settings. And then we're going to end with some actionable strategies. Talk a lot about ethical resilience, practical application, both in the law enforcement and correctional setting. Appreciate the bio from before. What I really want to share, first of all, people are welcome to research more about me if you're interested on LinkedIn. But what's important for today's conversation is that for the greater portion of my career, I have been working in community mental health settings, working in co-responder programs, in-reach programs for prisons, working in jails, juvenile detention facilities, supporting and leading crisis, detox, law enforcement programs. And I am passionate about the intersect of behavioral health and the justice system. Due to that passion, I have worked in those years where I was working in those settings and communities on local and state coordinating councils on criminal justice. I got to be part of putting together legislation to try to help improve, specifically to help improve those impacted who are getting involved in the justice system, predominantly due to their behavioral health. And you couldn't find me not advocating or researching on this topic. About probably midway through that career, I was having dinner with my mentor and now my friend and colleague, Dr. Joel DeBoskin, and he had asked me if I had ever heard of a program called EPIC, Ethical Policing is Courageous. I never heard of it, and like a good mentor, he just piqued my curiosity and said, well, you should maybe go learn about it. And I did, but then I went back to my job and back to the daily grind of running programs and working in these systems. And throughout my career, some of the hardest things that I have had to do is discipline, terminate staff, pull clearances from correctional settings for staff who have been involved in misconduct, made detrimental mistakes, and in one very memorable, unfortunate incident, relieved a staff because their own mental health and wellness had so deteriorated that they were no longer functioning well in their job. These are really dark times when you're a leader working in these settings. And for me, I came to realize that all of the advocacy programs, legislations, new evidence-based treatment modalities, anything that I and my team were trying to do, they weren't going to have the impact that we wanted if the workforce in those settings didn't have the support and training that they needed to not only be their best selves, but to prevent harm. I came to realize as I had worked up through the ranks and providing services to becoming a leader, that you, as a leader, you cannot be in every corner and on every shift. And this for me was the aha of active bystandership. That active bystandership allows us to leverage a power of everybody and really flips the switch on having each other's back from a blind loyalty to a constructive loyalty. That's really how I became passionate, pardon me, about this topic. And I want to share with you an example. This is going to be the first of a few times in today's presentation where I would ask of you three things. Number one, I would ask you to really tune in on this example because I'm going to reflect to it later on in this training. Number two, if you have something to write with, I encourage you to maybe jot down a couple of notes. It'll probably be easier to reflect later if you do so. And number three, just note that this specific example is very real. It comes from two examples that I know about are very real, but of course, names changes places to ensure confidentiality. So note that the jail setting that I worked in for years was in a sheriff's office, and it was a sheriff's office that both had jail and detentions as well as road patrol. And for any of you who have worked in a similar setting, there's a place called booking where people who have been detained by all sorts of law enforcement, but in this example, by the sheriff's deputies of that county, will come into the backside of the jail, and there's a holding room, if you will, where individuals will be held while they're processing information, potentially getting medical screenings. And depending on how individuals are presenting will really determine what kind of staff are there. So they're not essentially fully booked into jail, but they're in this holding area that is often what you'll hear about called booking. So I want to kind of paint that picture, if you will. And so 2 road patrol deputies brought in this individual, and this individual was very escalated, was yelling and screaming, and was very angry and escalated towards staff. And so it's not uncommon in this jail. They actually had one staff member. They pulled a deputy from the jail to stand with this specific individual, as opposed to putting this individual with others who were in the booking area, because they wanted to maintain and make sure that that type of anger and virulence didn't proceed to everybody in the booking area. And the deputy that they pulled was Deputy Lopez. Deputy Lopez had been working in this jail for about 5 years. She really wanted to get out to road patrol. She started working in the jail and found out that she was pretty well suited for it. She's very calm, very even all the time, kind of kept her head down, really kept strong boundaries between her personal life and professional life, but was a very reasonable individual to work with. And that's a great personality if you're going to work in a jail setting. So they asked Lopez to sort of sit on this guy. And this individual did not take lightly to her being in charge of monitoring him at that time. At this moment in time, he was handcuffed. So his handcuffs were behind him and he was sitting. And while he was sitting, he's sitting on a bench that is essentially up against a concrete wall. So metal bench, concrete wall, and he is detained. He's got handcuffs on. And so initially, Deputy Lopez is no stranger to being yelled at. I certainly had my fair share of being yelled at quite regularly by people who are detained in jail. And she kind of does her usual, just maintaining a calm demeanor, asking him to stay calm, while the other 2 deputies were over with the booking deputy, as well as the sergeant had come down. So they're in the same room. They're not that far away. But they're working on that processing of paperwork. This individual really starts to ante up. I mean, he's not just yelling, he is screaming. He is throwing out every name in the book, escalating his curse words. He is sort of physically lunging, even though he is in a seated position towards her. And Deputy Lopez multiple times is redirecting him, and it is only up in his ante. And he is throwing out every misogynistic, every racist, every horrible thing you can think to say to a human being. It's coming out of his mouth. And it is really getting to her. She is a calm, cool, and collected person. But this just feels like a barrage of hate directed at her. And she looks around and nobody else seems to even register. Everybody's going on about their business as if this isn't even happening. And from my experience, folks, that yes, people yelling at you in the jail is not uncommon, but it certainly isn't normal to have that level of escalation and nobody else jumping in. It keeps going, and she really shouts at him, "You need to shut up," to which that only escalates him even more. And she looks around again and realizes that nobody's even registering. She starts to feel her heart racing. She feels personally attacked. And he says one of the most hateful things you can possibly say to an individual, certainly a female. And she steps into him and she says, "If you don't shut up, I'll shut you up." And he basically spits at her. She takes his head and slams it into the wall behind him. At that moment, the deputy and the sergeants do pay attention. The sergeant comes down, takes her into his office, and dials internal affairs. That definitely was the end of Deputy Lopez's career, among all the other harms that occurred. And what I'd like you to reflect on now is, in that case example, what are those harms? Who was harmed? Certainly the detained individual was harmed. Deputy Lopez's career ended. I can share with you that when you're short-staffed in a jail, everybody feels the pain for that, right? There is litigation and risk that the entire facility receives, and those harms really have a ripple effect when you reflect on them. I would also share with you to think about, in your own career, can you think about a time where you witnessed the harm that happened at the hands of somebody else, or at the words of somebody else, or the omission of somebody else? And I would ask you to think about, what are those harms? How often do you still think about that event? And were there other witnesses to the harm? So we are going to come back to this case example. I like to use case examples when we're learning these important topics. But anytime I reflect on the Deputy Lopez example, please feel free to just insert your personal example if you have one, because I want it to be meaningful to each of you. So you're here on a training about active bystandership. It's important to start with some definitions and clarity. I want to read this definition. Bystander is a witness who is in a position to know that there is need for a positive action and is in a position to take some form of action. Now, this definition comes to us from Dr. Irvin Staub, who is a world-renowned researcher on active bystandership. This is going to be the first of many times that I encourage you, if you're taking notes, just write down Dr. Irvin Staub and BBC interview. And after today, I encourage you to go link those two up together in your Google search, and you can either listen to or read a fantastic audio article about Dr. Irvin Staub and the amazing impact that he's had in the research in this space, but also his personal story and his personal why for that he's been so passionate working in this. But I also want us to immediately start thinking about that Deputy Lopez example, right? I want you to stop and think, either for that example or your own personal, were there witnesses who were in a position to know that there was a need for positive action? I would argue yes. I would argue that there were two deputies, a sergeant, and there was a booking deputy, all who knew that there was an escalated detained person. And having observed and actually seen some of the tape of this individual, you can really see Deputy Lopez's nonverbals that this person was getting to her. And were they in a position to take some form of action? And I would argue yes, that they were in a position to take some form of action. So that's our definition of a bystander. But if you're really paying attention to the title and where we're at, you might be asking, what about active bystandership? And I want to jump right there. So bystandership, I wanted us to think about that definition from Dr. Irvin Staub, right? In a position to know that positive action is needed and in a position to do something about it. But now we have two sub-definitions that are really important to get clear on. We have passive bystanders and we have active bystanders. And you can certainly see how we have our social psychology definitions in these, and I think it's fun to play around with those. But I want us to really get very real about what it means to be an active bystander and what it means to be a passive bystander. So passive bystanders, straightforward, fail to intervene. And I don't use the word fail lightly. I'm very aware of the impact that that word has on many of us. But in that example, those two deputies, the booking deputy and the sergeant, all failed to intervene at escalating harm. There was harm occurring, certainly even prior to Deputy Lopez taking action. And more importantly than that, depending on the situation, is that they also discourage intervention by potentially making it seem like it's okay. So I want you to think about your personal example where you may have witnessed harm occurring, whether it was misconduct or mistake, or maybe you were watching a colleague or a peer deteriorate mentally, emotionally, physically, right? And you watched this occur over time and you didn't intervene. One of the risks that we have when we don't intervene and we see harm occurring is that we set the standard that this is okay, and people can assume that we're okay with it. I can certainly share with you that Deputy Lopez started to wonder if her colleagues were completely okay with the words that were being spewed at her from this individual. So we make a lot of assumptions in the absence of action and in the absence of clarity and calling out what is not okay. On the flip side, we have active bystanders who step in and they take action. Now, notice that I am not saying that they prevent harm. I wish that were the case, right? But this is not a bulletproof measure. But what we know is that when people take action, when they step in, they speak up and they do something, they certainly can improve the rate at which harm decreases, but they also very much communicate to others that it's not okay. Right? They send that very clear message. This behavior, this action, this harm that we are seeing is not okay. It's not acceptable. And that's hugely powerful when you're trying to potentially make an impact on what can seem like very difficult harms to intervene on. Now, here's where I want to pause and I want to throw out a challenge to you all. You can either privately reflect Perhaps if you want to share in the Q&A, that might inundate the Q&A, but I realize that we have limited opportunities to interact. But I want you to just think about, what are the catchphrases where you work or where you educate or where you learn or where you kind of aggregate that falsely communicates that there is a place of neutral? And let me back that up a little bit. So the social science, particularly from Dr. Irvin Stubb, tells us very clearly that when it comes to bystandership, you are either active or passive. You are either attempting to intervene and stop the harm, or you're not intervening, and the likelihood then is that harm occurs. There is no such thing as neutral. There's no such place of, I'm going to use one of the catchphrases that I often hear in workplaces that I work in, which is, that's above my pay grade. Right? That is a catchphrase that falsely communicates that there is a place of neutral where we want to sit in this place to say, well, I'm not okay with it, but I'm not going to intervene. And the research from Dr. Urban South tells us very clear, there's no such place. When people say things, I myself in my career, I have said the phrase, that's above my pay grade. What I now know is that what I'm communicating there is passive bystandership. I'm not intervening. I'm not attempting to stop the harm. And then to boot, I'm also trying to, say that I'm also not part of what's going on, right? It's just not the truth. So I would encourage you to think about, what are the catchphrases? There are tons of them. Once you start to unravel this, you realize that almost every workplace, every setting, every people have a phrase where they like to falsely communicate there's neutral, and now know they're not. So I just want to share with you that once I learned this, that there's no such place as neutral, I remember the first time I went to go say, I think one of the other phrases that I used to commonly say is, well, that's none of my business. Even though I knew harm was occurring, I did witness the harm and I was in a position to do something about it, right? I could have been an active bystander, but I stayed in neutral. And the next time I went to go say that, after I learned the social science, I about choked on my own tongue because I knew that what I was communicating was passive bystandership, and I knew how ineffective this was, and it would increase the harm occurring. Okay, so moving on, what I'd like to do here is a little bit of a deep dive into Department of Justice's duty to intercede, which commonly is referred to as duty to intervene. Their language is duty to intercede. Now, for those of you who like to dive in, you may have already started Google searching this policy and have it up and running, and that's fantastic. Remember, you do have the slides available to you, and I encourage you in multiple ways to make sure that you dive deep and learn this. But what I'd like to do now, I'd like to share with you some of the highlights from this policy, but I'd really like you, if possible, to tune in and think about how we would apply that to the Deputy Lopez case example or your personal example. I think that's how you'll get the best out of listening to this. So some of the highlights from this policy that was updated in 2022. Officers will be trained in and must recognize and act upon the affirmative duty to intercede to prevent or stop, as appropriate, any officer from engaging in excessive force or any other use of force that violates the Constitution, federal law, or department policies. It's pretty clear. The second highlight, all officers shall receive training at least annually on the department's use of force policy and its related legal updates. Also pretty clear. Next one. In addition, the training shall be provided on regular and periodic basis designed to provide techniques for the use of force and the importance of de-escalation, simulate active shooting situations and conditions, and reinforce the appropriate exercise of discretion and judgment in using less than lethal force. And that should all be documented. I want to unpack that a little bit. Again, you can have access to these slides through Qualtrics. I encourage you to look it up. I encourage you to think again about Deputy Lopez, right? Now, in the example that I am familiar with, in the jail version of this, at that time, that agency was doing annual training on their use of force, but they were not providing trainings that specifically tied together use of force policy and de-escalation. And I don't know how many of you experience this. In my experience working both with law enforcement and corrections, they often silo these trainings. So they'll have de-escalation training, crisis intervention team training, or CIT, crisis response intervention training, or CRIT. They'll have their own de-escalation training, which is great, fantastic. And then over here, separate, sometimes completely separated by date, time, trainer, and policy, they'll have their duty to intervene, which is actually their use of force training. And it's often just a policy mandate. Here's the policy, right? Don't use excessive force, make sure you intervene, and go do good. Unfortunately, what we know from social psychology, it's just not that easy, right? So they silo these trainings as opposed to the opportunity that exists to really bring them together. The other thing I want to highlight from what we just talked about in these two pieces of the DOJ policy is that when I'm doing consulting and training, I really encourage agencies to think about this policy for all harm, not just the use of force, right? Because I can assure you that agencies get sued and run into all sorts of problems from all types of harm that are not necessarily specific to use of force. And I also would encourage them that it applies to everybody who works in that setting, not just their sworn or their deputies or their police officers. And certainly as somebody who worked as a behavioral health professional in a jail, working alongside police officers, we are just as much exposed to the opportunity to prevent harm with active bystandership. Now, we've done a little deep dive on that. I want to do another deep dive. And again, I'm going to ask you, you will get these, you have access to this PowerPoint. I hope you use it. These are all hyperlinked to those codes. I'm going to pull out some of the highlights of each of these. And then I want you to really be thinking about how do they compare to what we just reviewed in the DOJ's duty to intercede. So I'm a psychologist, so I'm going to start with the bias of the American Psychological Association and their ethics code. And I actually want to pull out, some of the preamble highlights, right? Certainly we could talk about beneficence and fidelity and responsibility. We could absolutely talk about integrity, justice, respect for dignity and rights. But the one I want to highlight for today's purpose is competency. And as a psychologist, I feel passionate that if you are a psychologist and you are working in corrections and in law enforcement, I believe it is part of your ethical competency to understand the duty to intercede and what it looks like federally, in your state, and in your agency. I'm going to come back to that for a minute. The next link there is to the APA's, the American Psychological Association's specialty guidelines for forensic psychology. I know that is many of you in the audience today. I want to pull out some of the highlights from that. Impartiality and fairness, really recognizing the adversarial nature of the justice system. And I want to pause there. And for those of you who work in that system, perhaps you can relate to what happens when we get trained on really recognizing the adversarial nature of the justice system and how that starts to feel different when you're working inside of the system and around the system. That can shift for us. Multiple relationships, the therapeutic forensic role conflicts, and conflicts with organizational demands. That's a key one that I would really highlight as it pertains to the Department of Justice duty to intercede, is to make sure, right, it's beholden upon us to proactively compare our ethical standards to our federal, state, agency policies and laws, and really understand where there could be potential risks. So what about those conflicts with organizational demands? I also think it's important to really look at ethical standards that are near and around ours and not necessarily from psychiatrists, psychology, behavioral health professionals. So I have here the International Corrections and Prison Association, their ethical standards, and those include things like concern for citizenry, duty to care, transparency, and professional conduct. Okay, that certainly aligns with what we're talking about here. And then the International Association of Chiefs of Police, the IACP, their policing code of ethics. Some highlights include character and conduct on and off duty. And I want to include a quote that we're going to come back to for the IACP code of conducts for police. Constantly mindful of the welfare of others as well as my own well-being. One more time, because I think it's important for us to remember that that is in the policing code of ethics for IACP, constantly mindful of the welfare of others as well as my own well-being. We'll come back to that piece, but I really just would encourage you to be taking time in your competency, thinking about what conflicts you might have with organizational demands as it relates to the duty to intercede and expectations. All right, I promised you all that we'd do some social psychology comparison, and here we are. I'd like to give a little backdrop. Many of you, if not maybe perhaps all of you, know about or have heard about this social science experiment. So I hope that you, join in on the panel and the Q&A and share your thoughts and your guesses. But I'm going to give a little background, and then I'm going to challenge you to take some guesses here, even if it's just silently with you and wherever you are participating today. So this social psychology comes to us from 1968 at NYU, New York University. And our researchers, Darley and Latine, were actually inspired by events that occurred in New York City and what they were in the 60s. And what they really wanted to understand was, does the presence of other people around impact or influence whether or not people will go get help when they see or hear harm? That's what they wanted to know. And again, just not just will they intervene when they hear or see harm, but does the number of people around impact that? That's what they wanted to know. But like really good social scientists, what they asked students and told students that they wanted to study when they got students who were their research participants, what they said is, what we want to study is, hey, what is it like to be a student in a busy urban environment? We want to understand this, right? That's kind of how they pulled in their students for this. And when they would bring students in to this social science experiment, they would bring them down a very long hallway, multiple doors. They're really setting up that there potentially are a lot of people here. And they would take that student, right, their research participant, and they would bring them into their room. And that room had an intercom system. And they would explain that the intercom system was designed for a couple of different features. Some highlights include that when you're talking, nobody can interrupt you. And that's the same for everybody else in their intercom. That the researchers would not be listening in because they wanted students to speak freely, right, about what it's like to be a student in a busy urban environment. And that it would cut off at a certain period of time to make sure that everybody had the opportunity to speak. So with that, what they also did is they had their one student who they would bring in. But here's the thing, that student was led to believe in 3 different iterations that I'm going to talk about, that there were other students participating in this, but that's not true. They were actually the only student that the researchers were observing. What the researchers did is they had recordings of other students. And that was what sort of led the actual participant to believe that there were other students, because they had these recordings that were connected to the intercom. And in one scenario, the student who is the actual participant is led to believe it is just them and this other student. The next time they run it, our participant, the one student, believes it is just them, the one student, and then another student. And in the third iteration, they're led to believe it is them, as well as 4 other students, right? Because remember, our researchers really wanted to know about, does the number of people present impact this? And so they ran it 3 different ways, where our participant was either led to believe it was just them and 1 other person, it was just them and 2 other people, or it was just them and I think 4 to 6 others, right? So really kind of playing that up. But the one student who's always with them in every iteration of this is that one student, and that student in the recording, remember it's not a real person, will have a pretend seizure at some point during the experiment, right? So they're going back and forth talking about what it's like to be a student in a busy urban environment. And that student will share in their intro, they have a history of seizures. And at some point during the conversation, that student will start to stutter, sound not so great, actually say, I think I have a seizure going on, some more sputtering, and then they hear a thwack and it goes silent. And at that moment in time, what the researchers are really paying attention to is, does the actual participant leave their room to go check on this one student? Yes or no? And does that change if they think it is just them and that student, or if there's other students? So many of you are probably thinking, I know this already. This was Psychology 101, but I know there's some people here who haven't heard it. So, play along with me. I want you to write it down, and I promise that I will give you the results. So just write it down. What percentage of students do you think of those participants left their room to go check on the student having the seizure, which was a pretend seizure, it was all a recording, when they felt it was just him and the other students, so no one else can hear the seizure, right? Because the only student who's there is the one who's having the seizure, which again is just a recording. What percentage of students do you think left their room to go check? Write it down. Then I want you to write it down. What percentage of the same students, or put it into the chat as I see, that's also equally welcome. What percentage of those same students do you believe left the room to go check on the individual having the seizure, which again was a recording, when they believed it was them, the student having the seizure, and one other student? Okay, write that down. And last iteration, how about when they believed it was them, the one student having the seizure, and 4 other students? Write down what percentage you think left the room to go check. I'll give you just another second or two here, but I won't keep you hanging for too long. So the results were, in the first iteration, where they believed it was just them and the student having the seizure, which again was just pretend, 85%. Okay, that's the majority. The majority left to go check. But when we added one other student, that dropped to 62%. That's a very significant drop. But here's even more significant: when we added 4 other students, all the way to 31%. Now, I am a clinical psychologist, as you heard from the intro, but I do know that that is statistically significant, right? That's a big change, folks. So what our researchers, Darlene and Latine, pulled out of that is that it does matter. So it turns out it does, right? In this experiment, it really showed us that the number of people you add has an impact on whether or not we will intervene when we see harm. And I think it's important to keep in mind these 2 phrases that they used. I find them incredibly helpful. One was diffusion of responsibility, and that's quite simply, hey, somebody else is going to do it, right? So think about all those examples that occur in law enforcement and corrections. And if you really want to get real, folks, I think you should think about how that occurs in your life, right? In your work, in your life. Where does it happen in your workplace where you know that harm is occurring, where other people see that harm is happening, whatever that harm is? It doesn't have to be misconduct, it could be mistakes, it could be lots of other things, but people don't do anything because they assume someone else will do it. That's different than, but related to, pluralistic ignorance. And in pluralistic ignorance, this is really the phenomenon of second guessing yourself. And this one I am so suspect to. This is unfortunately my Achilles heel. I'm not saying that I don't fall prey to diffusion of responsibility, because I know that I do. I'm a human and I err, but I constantly think that everybody else is right and I am wrong. So when I walk into a situation and there's lots of other people in there and there is harm occurring, and I start to have this dissonance, right? What's going on? I see harm is occurring. I want to intervene. I look at everybody else, and if no one else is doing or saying anything, I think that I'm wrong. Maybe I misunderstand what's happening. Maybe this is okay. Maybe everybody knows about it. Maybe it's apparently a big practical joke on Abigail Tucker. But what I now know, after really understanding this foundational social science, this is why I think it's key. We should stay up to date on our science and research, but we really need to go back to some of our foundation basics, is that I'm more likely suffering from, and I like to use the word suffering, that might not be the correct term, a pluralistic ignorance. Actually, the correct would say that probably other people are suffering from my pluralistic ignorance, right? So I'd encourage you again to think about examples where that might be occurring. I want to actually challenge you to think about Deputy Lopez. Is it possible that people thought, well, somebody else will do it, right? Maybe the sergeant will do something. Maybe the other booking deputy will do it. Is it possible they're having pluralistic ignorance? Maybe she's fine with it. Maybe she's totally okay. Maybe it's not that big of a deal. There's lots of reasons that people may not have intervened. And I think the key that I really like to highlight here is that it might not always be because you're a bad person and we want harm to happen. And this is a real crucial learning curve when it comes to this research, and why I'm so passionate to bring it forward. I am very concerned in the work that I do that we have a lot of us versus them, and we silo. And the problem with that is that we're not learning from each other, and we get really good at pointing fingers and assuming that people did not intervene to prevent harm because they were okay with it. And I know from the research now that that's, generally speaking, and in my experience of working with folks, not the case. And something else I want to share with you is that there's another really common reason that I observe that people do not intervene when they see harm occurring. And that is because the work is really hard. It is really, really tough work. The connection that I want to make here for you folks is that when we are not our healthiest and best selves, we are not as likely to make healthy and high quality decisions. And that is not just our actions, but that also means we might not be in the best position to notice when other people are not their best selves. My personal example is when I was in a very bad state. I was absolutely experiencing secondary trauma. I was working with sex offenders in a jail setting. It was really tough work. And I was doing a good job, right? But I was not doing a good job internally. I was completely becoming complacent and I had full compassion fatigue. Absolutely. And my example is when I had a parole officer who I did not have a very good relationship point out to me that one of my own staff was engaging in some really risky behaviors at work. And I absolutely did not want to accept this feedback for lots of different reasons. Um, but what I came to realize is the number one reason I didn't want to accept it is because I was so upset that I didn't see it. This parole officer was correct. And it is not that I was ignoring those behaviors. I just didn't see it for what it was. I was so wrapped up in my own burnout, my own compassion fatigue, just trying to get my work done that I didn't see it. And that takes a huge toll. And I realized then that that occurs to other people, right? In my situation, it was a psychology trainee. But that occurs to both people working in corrections and law enforcement. And it's imperative that we talk about that if we want officers, correctional officers, if we want them to more effectively use de-escalation and intervene and create a culture of active bystandership that prevents harm, then we have to figure out how that also keeps them healthy and well, or we won't get the outcomes that we want. I have some quotes up here up on the slide that come from research. Rosemary's work on correctional research is unbelievable. She's a Canadian researcher. I highly recommend you read more about her work and her research. That's on the right-hand side. But I also want to just read the quote from the left. The violence in prisons haunts guards' lives, private lives. They begin to treat their family and friends like they treat incarcerated persons. And this behavior often leads to domestic violence, drug abuse, and feelings of guilt. And I've witnessed firsthand what happens when the health and wellness of correctional officers deteriorates. It impacts how they treat incarcerated people. It impacts how they work with professionals like psychologists and psychiatrists. It impacts their ability to intervene if they see harm occurring from their peers, and it goes home with them. And that is unacceptable. That also happens in law enforcement. If you're not familiar with Jetelina's work, I highly recommend you check out that research article. I've got the reference there, and I also have it in the references again that are attached to the slides. You all have access to those slides if you're registered here today. But I also think I do want to read from the quotes on the left. Police officers can experience a moral injury when they are ordered to perform enforcement actions that run contrary to their moral values. Police officers can experience a moral injury when they observe the behavior of trusted colleagues or supervisors violating their moral beliefs. I would offer that as psychologists and psychiatrists and other individuals working in forensic settings, I have had to really come to grasp with some of my own moral conflicts and moral injuries in the work that we do. And it has been helpful for me to realize that my peer law enforcement and correctional officers are experiencing the same thing. And that allows me to do less of blaming and shaming and do more asking and seeking to understand what do we need to do to elevate the culture and the outcomes. And I believe strongly that bringing high quality active bystandership training is a huge part of that, because how they learn to do that duty to intercede policy that we talked about in a way that truly helps bring de-escalation to that. We can't keep siloing these trainings, and that happens quite often. And I believe that we can play a role as psychologists by understanding this, but by also bringing those elements and bring the psychology that that you probably all know about. How do you infuse that into this aspect of the work that you're doing? So, thinking about that quote that I shared earlier from the IACP Chiefs of Police Policing Code of Ethics, I'm going to quote that again. It said, one of their ethical standards is to be constantly mindful of the welfare of others as well as my own well-being. I think it's important to remember that when we do not attend to the health and wellness of people working in law enforcement and working in corrections, it does not have good outcomes for those justice-involved individuals as well. And what I would offer is that one way that psychology can help with this is by helping people understand that the duty to intervene or the duty to intercede and their use of force policies, it cannot and should not be a policy mandate training that says, don't do this bad thing. We know as behavioral health professionals that it is not as easy to change behavior by just telling people what to do and what not to do. How can you, as psychologists, bring your expertise to help people understand that how they train, bringing awareness, social psychology, insights can really help shift their training to be more impactful, so that they're not just told, don't do that thing, but they actually understand why it's hard to intervene on their peers and what they can do about it. How? Skills. It does take practice. One of my big takeaways is I encourage every single one of you to learn more about this. So if you at all liked or interested by anything that was said today, even if you don't like me and you're not interested in hearing my voice anymore, no offense taken, you can check out this TED Talk by Dr. Catherine Sanderson, The Psychology of Inaction. You can read her book. You could read Dr. Erwin Staub's book. There's a ton of podcasts and research out there. I encourage you to learn more. Here's where I want to challenge you to apply this, right? I want you to think very clearly. Where there is use of force training, there is a need for active bystandership training. Again, I believe that policies tend to silo these trainings, right? They put use of force over here and then duty to intervene over here, but how do you pull them together? They put use of force and duty to intervene over here, but de-escalation over here. How can we encourage to bring them together? I believe also that where there is a need for workforce wellness, there is a need for active bystandership training. I'd be curious how many of you have helped support and foster wellness training and supports for correctional and law enforcement agencies. And in my experience of doing that, I regularly and frequently hear, yeah, I think we have a ton of resources, but people aren't using them, or they're not using them as much as we need. And I believe that active bystandership is a key that will unlock that. Because what I want to see is that peers tell each other, hey man, I'm worried about you. Maybe you need to get some help, right? Or, hey friend, we started together in the academy. This is not you, and I want to be your friend, but I really think you need to get connected to resources, right? So our embedded psychologists, peer support teams, chaplains, they cannot be on every shift and every corner. They're ready to help. They need the entire workforce to be trained in active bystandership, that if you see a colleague deteriorating, how do you reach out to them and get them connected to the resources? We talk about this all the time in social psychology, but active bystandership is often the missing link to why it's not happening as much as we want. I would encourage you to learn more about the DOJ's use of force policy. I would really encourage you to dive into the case law on this. That has been a fascinating, sometimes terrifying endeavor for me when I look at both in corrections and law enforcement. Check out the case law on this. It's very informative. Especially check out so that you can help share, bring some real perspective if you have the opportunity to talk to administrators and leaders, right? It's one thing to say, hey, this is policy, what are we doing about that? It's another thing to bring a case law of, hey, I found this case law where people were arrested, paid millions of dollars. How do we make sure that doesn't happen here? Compare your own ethical standards. I talked a lot about psychology standards because that's what I know about, but for the multidisciplinary setting, know what your ethical standards are and compare those to justice, especially the systems where you're working in. And I challenge you to find common ground. It is a lot easier to make progress from common ground than from opposing perspectives. And with that, my final is to inquire and advocate that active bystandership training elevate policy mandates to a culture that prevents harm. I do want to prevent harm. I want to reduce mistakes. I want to promote health and wellness. But I know that myself and others who work with me on this, we can't do it alone. We really need system-wide training and culture shift to make it so that we prevent harm. These are my references. And again, they are going to be in the slides that you all have access to through the links. I do want to offer the evaluation link and QR code here. And then I want to check in for any questions.
Wonderful. And thank you so much, Dr. Tucker, for that very helpful and also personable overview of bystandership and active bystandership in particular. I think this is an issue. I mean, we're talking about this from a public safety perspective, but I think, you know, it's an issue that I think will resonate with a lot of people in their professional and personal lives these days as well, in different ways. That this is a really critical issue. As you noted, this is the QR code availability up here shortly, or actually right now as I was talking. In the chat box, you will see the link for the APA Continuing Education Survey. Make sure you save that or bookmark it or otherwise open it before the webinar closes. We do have a number of questions here already, but feel free to put any other questions you have in the Q&A box, and we will go through a couple of those now. One person said, you know, many thanks for covering this great topic, and asked about, is there a risk that some bystanders are at risk for, like said, second victim syndrome? I know you had other terminology there in a related concept, but if so, what would you recommend should be undertaken to help mitigate risk of some second victim syndrome?
Yeah, I'm not sure that I totally understand the question. So is the question that you intervene and then you experience harm because you intervened?
I'm assuming that that's what that's getting at.
Okay, because that does happen a lot. So it's a fantastic question. I just want to make sure I'm not misunderstanding it. Yeah, first of all, what you hit on is that that's one of the primary social inhibitor reasons that we don't intervene, that we think that we're going to get in trouble, whether it's retaliation or we're going to get isolated or be left out of the peer group or labeled a snitch. So I think it's important to actually name that for what it is. It's a cultural inhibitor to us intervening. And what I would say is that you've got two primary ways to tackle that. The best way to tackle it, in my opinion, is to have a training that is agency-wide in active bystandership so that everybody from the top down, bottom up is getting it. It really starts to tackle that hierarchy that can exist. And the other thing I would say is it's imperative that you get leaders on board who adopt it in a personal way, that they share their examples about how they were not perfect and how people intervened on them and how they're thankful for that. Those very specific, real examples can really leverage a much faster cultural shift to expecting that. But the last thing I would say I think I heard the mitigating your risk for that is that seek to understand. So whenever possible, if it's not immediately life-threatening, when you go to intervene, seek to understand first, hey, what's going on here? This doesn't make sense to me. Help me understand what we're doing here so that we are trying to leverage and have their back and not undermine them in a potential moment of stress.
Wonderful. There's a couple of questions here that are kind of, they're overlapping on different sides of the coin. So I'm going to just go ahead and merge these together. Somebody said, aren't there situations in which it is better for people to remain passive? And the related question is there a downside to active bystandership? Or what is the downside, rather, not if, what is the downside?
Yeah. Well, let me start with the what if question, then I'm going to come back to the passive one. So the what if question, I think the downside to active bystandership is so the risks or the downside of active bystandership is really similar to think about any other time in your life where you are putting your ethics and morals of value ahead of other interests. That is the risk. And every single one of us in our training, and most of us in our experience, have had times where we've had ethical and moral values that are in conflict with our agencies, our personal risks, our financial and professional risks. And so what you risk with active bystandership is that you do absolutely risk that potentially you could experience retaliation if you are not working in a culture that has adopted active bystandership. You risk that. And I think that's why I encourage people to double down on your ethics and your morals and your values. I know for myself, that's been helpful when I'm facing a risk, such as, how about just on a personal example, when I have to give a peer feedback about their performance that I know that they don't want to hear. I know that I'm going to risk that relationship, but I also know that if I don't give him this feedback, I'm not holding true to the values and morals that I have, not only about active bystandership, but my commitment to this individual to make sure that they are their best selves, right? And I need to do that. So I'm risking the relationship there. So that I would say, again, you mitigate that risk by the technique that you use and by having a pre-established relationship that invites active bystandership. Those conversations have gone a lot better for me when it's with somebody and we've had the active bystandership conversation than with somebody who I've never had that conversation with. To the question though about does it remain passive? The one thing I do want to say is that there's a very common, especially in corrections and law enforcement, if there is not immediate life and threat danger, right, then I would highly recommend that there are many times where a skill set that I would call engaging your allies, it can seem like being passive in the moment, but you're not. You're being an active bystander. So an example that I will give is a brand new deputy who is witnessing some infractions of policy, right, when they're new to their either in corrections or on the street. And they don't feel confident or comfortable, or they don't feel like they're in an environment where they can intervene without risking their own job, reputation, relationships. But they do follow back up with their field training officer, with a mentor, with a leader that they feel comfortable to say, hey, I witnessed this. What do I need to do? How do I intervene? How best do I do it? And the flip side of that is that if you are witnessing a colleague's mental health and wellness decline, but you are not the best person to talk to them, there is nothing wrong with going to a friend and saying, hey, I'm really worried about so and so, but I don't think I'm the right person to talk to him about it. Here's what I have observed. Here are the resources in our agency. Would you please go talk to them? Right? So we can engage our allies. That's not gossiping, that's not toxic work culture because we're out for people's best interest, but that's still active bystandership. So in the moment, maybe you don't intervene. And the last thing I want to say about that is that also, if in the moment you are passive and you do not intervene, I also take, how do you just learn from that? I know for myself, I live and breathe this stuff, and I still have times where I think, oh my gosh, why didn't I say anything? Perhaps I was in an amygdala hijack. Perhaps I was really tired. Perhaps I had pluralistic ignorance. We are all human. How do you back that up, rewind and learn, and try to do differently the next time?
Wonderful. Thank you for that. In your answer there, you referenced some of that internal potential fear of consequences or retaliation. Very understandable response that many of us could have. Somebody asked, how would you propose correctional staff address retaliation if it does happen, be it direct or subtle, when they report actions of peers or intervene, placing a peer in potential legal jeopardy?
Knowing their agency policy retaliation. Sometimes that also means working with supervisors and leaders, but I would also say sometimes having a follow-up direct conversation. I did this, I experienced this. Is this what you meant? Did you mean to retaliate against me or not? And for many institutions and agencies, it can also be helpful to tap into your union representation as well.
Great. And is there anything you would consider in terms of how you would address active bystandership amongst minoritized populations who may be concerned about particular discrimination when speaking up?
Oh, in 10 seconds or less, what I would say is that I would validate that that is a real concern. And where can you start in your circles of influence and circles of control? Where can you start normalizing this and practicing this and leveraging allies for the things that you're concerned about to bring that into a wider audience?
We are at the top of the hour. Yes, you said 10 seconds or less. Thank you so much for all of this, Dr. Tucker, Abigail, for all the work that you're doing in this, and the inspiration here for people to help and assist people standing up in bystandership. Thank you so much for all that you've done in this area. And that does wrap up this week's Law and Mental Health series. Next week, we have Dr. Candace Shields, who'll be discussing involuntary and voluntary intoxication, fixed and settled conditions, and legal insanity. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time.